China is getting old very quickly, but we have very relatively few nursing home infrastructure in place compared with the United States. Because in the old days, the social contract is 3 generations living together, and you take care of your parents when they get old. So we don't have nursing home. So the good part of this lack of legacy is actually we could think de novo, what is the best way, best technology, the best organization and best business model to handle all these things. Like most Chinese families never own a landline phone, they go straight to mobile. So that's one of the good things. The other thing is the intangible. One thing I feel if you travel to China those days, going to Beijing, Shenzhen, and Shanghai, you feel there is this enthusiasm, this confidence, this optimism to the future that we are willing to try new things. So we have tremendous need. After 30 years, we have a little bit of money to take care of our own people, and we don't have the existing established way of doing things, and we are willing to try new things. So that makes China extremely interesting as a lab, as a pilot lab for trying new things.
Colin was talking about the Chinese government planning process, and one of the 8 pillars of strategy in infrastructure development is to promoting the use of IT in healthcare sector. I was very fortunate to see in Ningbo, which is one of the city in Zhejiang province, the disease management software has the entire population on the database. And I can see the list of the people with hypertension, list of people with diabetes. I can see the community clinic doctors actually were managing them. And if there were any communicable disease came through in the system from even just community clinic all the way to the tertiary hospitals, I can see that the second the diagnosis were made, the information automatically were sent to the CDC. Throughout the world, in my work, I've seen many paperless hospitals in different parts of the world. But I really have very rarely seen the records being so well integrated, including every dose of vaccines going through the whole chain.
So we have been producing vaccine all this time, so our vaccine is good. But problem is our vaccine hasn't been
gone through the process.
Properly recorded. For example, the seed bank, we have done it properly, but not recorded. We publish our data in Chinese magazine, but nobody in the world can read it apart from Chinese. So that's the problem we are having now. So we also collaborate with PAS and Gates Foundations to bring ourselves to the international standard. So next step we're going to looking for is kind of partnership. That is the main thing we are trying to going forward with, is partner with the outside, the company from outside China with good technology, and so we can use our kind of the advantages in terms of manufacture and in terms of labor costs and so on in China, and match with your good technology, then we can go forward, make these things affordable, and make a cover access to a larger population.
So the aim of this, the last round of health reform is get the affordable and accessible health care. So we gave our overall health plan. The main contents is the 4 pillars and 5 priorities. On the consumer side, the central and local government subsidize the residents, including the rural and the urban, to join the program, insurance. And the other side, the central government invests big money to establish the commune health organizations in the urban and also re-establish the township hospital and clinic office in the villages.
Okay.
So after 3 years, dramatic change. For example, almost 95% of the whole population covered by the insurance program.
Yeah.
This new turn of the reform take place in China is an institutional reform. We give big money and add some insurance program, but how to increase the efficiency and give a very qualified and timely service is still a big problem. So I think next round reform, we need more technical innovation